Hello, welcome to my channel. My name is Chu. Today we're going to talk about why EKG technicians are essentials to the healthcare world. One, because that's what they train for. They have a certifications or diploma to become a EKG technicians. Okay, so they learn how to do EKGs on all ages, including infants, children, and adults. They also know how to do EKG on patients with the heart on the right. Some people were born like that. Their heart just located on the right side of the chest. So you don't do the normal standard EKGs. You have to follow the procedure to do the diagnostic test like that. That way, the result won't be skewed to save a patient. Okay, and then I never done EKG on infants before or even children, so they are specialized to do that too. I think the next time we'll talk about that. But I'll do some little research and we'll do that. But I imagine it's not that hard. They also have BLS certified. Every healthcare personnel should have BLS certified. And number two is because they can assist the nurses with the emergency situations, such as stat EKGs, with the code, with the rapid response, chest pain. Number three is to maintain EKG machine and kind of fix it to where it can work. To make sure that the EKG is stocked, ready to go. Razors, EKG tabs, EKG wires, make sure they're all working. But the electric is just like clippers. They're not razors, they're clippers, so that you can't hurt nobody with that. Number four is EKG techs can work in the telemonitor room. They can watch the patient's heart activities and heart rhythms and heart rates and all that stuff, just so that way someone can communicate with the nurse in case something's wrong with the patient's heart rates. And it is important to monitor patients' heart rhythms. That's why EKG techs are assigned to sit in that monitor room to watch the patient's rhythms. Number five is they have to have excellent communication skills when the heart rates drop or the heart rates increase. And normal heart rates are between 60 to 100 for adults. I work in the adult unit, so that's mainly what we're focused on, adults. And we'll talk about children in another time. They have excellent communication skills, and when they perform the EKG, if it doesn't come out right, they will tell the nurse right away. Of course, the nurse will review the EKG rhythm after you print it, but if attention needed stat, they can communicate with the nurse or the doctor right away. That way, the patient can be taken care of and get treated as soon as possible. They can work in various facilities. For example, they can work in the pre-post area, like pre-procedures, like the inpatient units or the outpatient units or rehab, any place like that. It'll be nice to have a EKG tech so they can help you. Of course, everybody has to get certified, but that doesn't mean that they do it every day. And so you have to map correctly, place the lead placements correctly to get correct readings, and diagnostic tests can be defined by the doctors. If you misplace or the diagnostic test, EKG test will be skewed, and that's not safe for the patients. And because they have exceptional customer service skills, internal and external skills, plus EKG tests can be a PCA or PCT, whichever the hospital prefer to call them, such as CNA jobs. They have additional responsibility, which is EKG. Thanks for all you do, EKG techs, and thanks for saving the cardiac patients. Take care of yourselves while taking care of your patients. Travel safely in between patients' rooms and throughout the hospitals. If you do carry that pager, be careful, and I'll see you next time. Thank you. Have a blessed day.